And welcome back. We're at halftime for Wayne State basketball. We are pleased to be joined tonight for tonight's game by Dr. Dalia Khalil, who is an associate professor in the College of Nursing here at Wayne State University. Dr. Khalil, first of all, thanks for joining us here at halftime, taking some time out of your busy schedule. How has the fall semester been going?
Hi, it's been going very well. Thank you very much.
Yeah, and it's almost over. We're to that time of year. It's the holiday season, and it's almost time to start thinking about the winter. Dr. Khalil, why don't you tell everybody out there what you do here at Wayne State?
I'm an associate professor in the College of Nursing. I'm tenured associate professor, and I earned my PhD here at Wayne State University in the dual title program of nursing and infant mental health. I've been a professor here since 2017, so this year is going to be year number 8 for me.
Well, that sounds great, and graduate of Wayne State as well. Why don't you talk about your research as a whole before we get into specific questions? What has your research mainly been focusing on?
So, as I said, my degree is in infant mental health and nursing. So, my work is focusing on infants and toddlers' mental health as related to their parents, specifically mothers. So, maternal mental health as related to infants' mental health among immigrant and refugee population. I focused on mothers, infants, and as well as fathers in some of my studies. And what I noticed over the past years is that immigrants and refugee mothers, they have high risk of anxiety and stress and depression, and that can be negative, can cause negative consequences on their children.
Yeah, what motivated you to start to researching this specific subject matter?
I started with focusing on postpartum depression among mothers, and I noticed that immigrant and refugee mothers, they have high levels of postpartum depression. It can reach up to 37%, and in the US, it's about 12 to 13%. So it was really interesting for me to understand what causes that depression, as well as the consequences on the children, because there is the intergenerational transfer of stress and trauma from parents to children. And those children of immigrants going to be the citizens of the US. So it is so much important to raise healthy children for a healthy community.
Yeah, absolutely. I'm supposed to ask you about AR. I know you can probably explain what AR is a lot better than I can. So why don't you explain to the audience what AR is, and we'll get into some questions about that.
So AR is the augmented reality, and it's a new technology that has interactive interactions with human computer, like human like computer generated technology.
Mhm.
It will enable individuals to interact with different people environments within their own environment, so it will keep the feeling of the real environment, and it will combine the virtual objects within the environment that the person is existing. So, augmented reality, this technology, specifically the one that we're using in my study, it was created by my colleague, Dr. Araj Javenbach from psychiatry in his STARC lab. And we are utilizing the augmented reality technology to pilot an intervention to improve social connectedness of immigrant mothers and to decrease social anxiety among newcomers.
That sounds very interesting. You explained that very well. And how does augmented reality support well-being compared with traditional methods of support?
But this technology, it allows the person to practice an interaction with human from different diverse age, sex, race, and situations within a safe environment. So this is what's unique about it, is that the person is able to interact with characters and individuals within a safe environment. So there's no judgment, there's no embarrassment, there's no shame about this interaction. And this interaction is within the limitation of the language limitation, the cultural limitation that immigrant population might have. And hopefully, this technology will improve their social functioning, because we will offer it in 40-minute sessions, and hopefully we can do 4 to 6 sessions in order to improve social interaction.
What are some of the early outcomes of your research or stories that best illustrate the impact of your work so far?
So this study is a new study. We are getting started, and actually we're getting a new participant this week to start the first session. So I'm hoping for the outcomes is to improve social anxiety. So we will have the participants answer some questions about social anxiety, PTSD, depression, and we will follow up with participants in each session. And our participants, again, are mothers who are immigrants or refugees. And we will follow up with their scores and see if their social anxiety will decrease over time, if their PTSD symptoms will decrease, as well as depressive symptoms, if that would decrease. This technology was used by my colleague, Dr. Javenbach, among police officers and first responders, and it showed very positive outcomes. So I'm hoping this will be positive as well for this population.
Absolutely, and it's definitely important, especially with, we won't get into it much here during the interview, but what's been going on with that immigrant population, especially as of late, no doubt about that. Looking ahead, what does success in the next 3 to 5 years look like, and how can others get involved in this research with you?
So within this year, we are piloting this intervention within 25 mothers, and according to our results that we will get from this pilot, we are hoping to apply for a bigger grant, hopefully a federal grant like an NIH, in order to have a bigger study with a larger number and more sessions to follow up with immigrants and refugees. And within the next 5 years, I'm hoping to expand this and to understand the consequences that can help mothers at the long run in order to improve their social interaction, their stress, their psychological symptoms that can definitely influence child outcomes.
It sounds like some great research you're doing, no doubt about that. Is there any information that if the public listening wants to know more about your research, a website they can go to find more out about this?
Thank you very much. Actually, again, I'm collaborating with my colleague. He has a website. It's called the Stark Lab with the C, so STARC. Part of Wayne State University. And again, for this technology, it is expensive to develop. It's expensive to have the software, but once it's developed, which we already have right now, it is easy to accomplish and it's easy to apply, and it can be incorporated within clinical settings or clinics in order to improve psychological symptoms among different types of populations. But again, this pilot is among immigrants and refugees, but definitely we can generalize and try it out with different populations.
All right. Well, Dr. Khalil, thanks for joining us here at halftime tonight. Best of luck with your research. You're doing some great work there, and take care. Have a great rest of the semester and a great winter semester, and go Warriors. All right.
Thank you very much. Go Warriors.
You're welcome. That's Dr. Khalil from the College of Nursing here at Wayne State joining us at halftime. Stay tuned. Second half coming up after this. You're listening to Warriors basketball.